Hey everyone, it's Dr. Rick. I'm not going to talk about Colorado, but I do go there often. I like to train in Illinois, but it's boring and it's flat. Our summer in Illinois is very short, and then it becomes cold and dark. I'd like you to take advantage of the great weather, but not at the price of getting Lyme disease or West Nile virus. So there's a couple of tidbits of information I want to teach you. Please be careful about the insects that you might take home with you or take as a hitchhiker. There are certain areas of the country where Lyme disease and West Nile virus are really rambunctious. Let's just talk about how to prevent those things, those diseases. First off, there are barriers that you can use that'll keep you safe. This is my head net. This does look a little goofy and a lot of people will be apprehensive, but when you're in the woods and you are covered by insects, it gets to be really annoying to slap yourself or be going like this all the time, and it breaks up the possibility of enjoying nature or nature therapy. So this does work as a great barrier. If you have a hat on, it works even better because the net gets pulled away from your skin, because mosquitoes can still get to you if this is touching your skin. This is one option, and you can tuck it away into this. This is about $4 at online or at REI. Long sleeves are important as well. And I like to wear short sleeve, tight-fitting clothes, but in the summer you would figure maybe wear shorts and short sleeves. If you're going into dense brush, especially after a day or two of rain, those mosquitoes are going to be nasty. You would think also with regards to Lyme and ticks that you don't have to worry if you're just going through grass, but the other day I was just brushing along with high vegetation and I picked up a tick in my hair from a tree. And I'll show you this in a second. You always have to worry about high and low as far as ticks. So another thing that you can do as far as barrier is spray your clothes. So I know some of you don't like using chemicals. There is something called permethrin. This is something you can get online or at REI. Ticks hate this stuff. And you can spray your clothes and it lasts for a couple weeks. So usually I'll offer this to some of my hikers. I'll spray down their shoes and I'll spray down their pant legs, and I'll usually leave it at that. Me, I kind of spray the clothes I have or I'm going to plan for the week. If you're in Illinois, please come out. I'll be doing a hike this Saturday, July 2nd at Swallow Cliff Stairs. Check me out on Herbal 411. I'll put the link down below, or again, Facebook, Dr. Rick Hiking Excursions. Please sign up. You're more than welcome to join us. We're doing a forced march, and then I have other hikes that my group going to Zion will be prepping for, and you don't have to go with us to Zion if you want, great. But if you want to just get out with camaraderie and getting out for summer, then that'd be fine too. Activities like hiking aren't going to be getting you really muscular, but it's better than nothing, and it starts your lifestyle change. You can use sprays for mosquitoes, but DEET is a little bit irritating. And there is controversy about DEET and its side effects, especially if you have kids you're taking care of or pets. But we'll just talk about humans at this point. I like Repel. This has had a lemony flavor. There are some chemicals here. Theoretically, it's natural. I think I've seen some videos where people have sprayed this on plastic and the plastic melted. Time-lapse photography. This is somewhat natural and it does work great. This does sting though. I've sprayed this onto my hands, used it around my face and neck, and it did sweat and it got into my eyes and it stung a little bit. Typically, I'll spray my arms. I'll spray areas where mosquitoes like to bite, where I'm not protected from barrier. I like the permethrin for cloth protection against ticks. I like the Repel for mosquito protection, especially in stagnant areas where wind is not going to be my friend. Wind and weather can protect you against mosquitoes. So here's another thing that you should be looking at. If a good hiker or a team leader can check the time of day. Mosquitoes typically stay dormant when it's a lot of light or sun, and also when it's cool. Midsummer, depending on where you live, will be hot all day long, but there are going to be some days, if you look at the hourly forecast on the Weather Channel, when the temperature drops 60 degrees, mosquitoes stay dormant, especially at the bookends of the summer or the end of spring and then the beginning of fall. Those are the perfect times to get outside. If you're lucky enough wherever you are, a cold front might come in. Check the Weather Channel. This Saturday, I'm going to be watching the Weather Channel. If we have a cold front and it's going to be cold in the morning, I'll get our group out earlier just so that we can avoid having to spray. It makes for an easier hike, and or if I am the team leader and I choose the hike of the day, if it's cold and we're not going to be running into a swarm of mosquitoes, I'll choose or pick the trail that goes deep into the woods so it makes it exciting. There are some canyon trails that are great when there's no mosquitoes. Otherwise, it's going to be hot, muggy, and post-rain. I'll probably stick into the wide berth trails to avoid the mosquitoes. But those are two chemicals that I choose to give to my teams to prevent West Nile and the possibility of Lyme. If you do find a tick, and I found a tick the other day, I was doing my usual post-hike tick check, and I felt a little, I must have a stone here. And it was not moving, and I thought, uh-oh. So I pulled it, it was a tick. And it was this guy. I usually bag and tag these, pretty much suffocated, he's dead. I'm gonna send this off for analysis. I looked at it with magnification and it looks like the typical wood tick. If I was OCD, I would send it off to IGeneX. If you ask your doctor, send it off to your lab for analysis. IGeneX is the most robust lab that does evaluation of tick bodies. So they do blood testing, which is what this order set is. They also give you this nice container, so if you do the blood testing at your local place, you can enclose it in here. I think it even has, even has the tubes that you're supposed to enclose it in. You can bring this kit, well, you have to have your doctor get the kit. If you're one of my patients, my warriors, and subscribe to Herbal 411, I'll send this out to you or give it to you. And then you can either bring it to your lab and have them draw using the tubes and pack it away. I don't know that insurance pays. It's worth it. If you submit this little guy for analysis, the arthropod, your doctor has to put a diagnosis of evaluation for Lyme disease. Hopefully the pathologist that reads this will evaluate, look at the specific markings of the tick under microscopic and say, is the tick that carries Lyme disease or is it not? Now, if you go to IGeneX, they'll actually evaluate even further, not only looking at the markings to see if it's the tick that carries Lyme, but they take it the next step further to look at the saliva, if the components of the carcass are still viable, and they'll try to culture out the spirochete. I'll leave that to the IGeneX guys. I have a video on what they do exactly. Worst case scenario, if you've already burned your tick, which a lot of my boomers do, they pull it off their dogs and they burn them because they don't know what to do with the tick. That's fine. There's a big question mark. What do? Do we just treat? And here, I know some people are going to be asking me, this might be where if you're in an endemic area, and somebody for my patient says, well, I got bitten, it's high season, what should I do? I might suggest, especially if you have multiple medical problems or a previous history of Lyme disease, I might suggest you do a few weeks of doxycycline. Yes, that's going to destroy your gut microbiome for a short time, but if you're healthy, the gut microbiome will bounce back and repopulate. It will recover. If you're unhealthy, you probably won't get Lyme disease. The question is there. Understanding the risk and benefits of antibiotics. Options are that we can also check for Lyme and its cousins, Bartonella, Babesia, Anaplasmosis, and Ehrlichia. We can check every 6 months, but it's almost like having unprotected sex and you find out your partner had HIV. I can check you every 6 months to find out after 2 years, say, nah, you're negative. But that time period where you're waiting for the HIV test to come back, you're biting nails for about a week until it comes back and then say, oh, okay. I would rather have the tick and sleep well that we're cool and be done with it. Save them, put them in a Ziploc bag, see if your doctor will send it off. Whether you like antibiotics or not, doxycycline, it's not really broad spectrum like Augmentin, Zithromax, that's really broad spectrum. Just to give you a comparison, doxycycline is what we give to teenagers for acne. So it's the same antibiotic. Just think about it, it's just an option. There are antimicrobial herbs that you can use, garlic, ginger, there's other things that you can use that will help the gut microbiome turn the immune system on. In theory, the mechanistic data is a little bit limited. I don't know if that really kills Lyme disease, but it ain't gonna hurt. Aftercare, you just have to not scratch. And it's not necessarily for Lyme. If you have a questionable bite or you pull off a tick and you did what we just talked about, but you start to develop a rash, that's a problem. Even if it's 6 months out, please take a picture of the rash and watch its evolution. I've actually taken care of people with a rash several years later and it looked like psoriasis. This guy came in with every year, same rash, treated with topical steroids and oral steroids, and I thought, that is too much steroid. We biopsied it, checked him for Lyme. He was positive for Lyme. So we finally hit him with a course of antibiotics. I sent him off to my favorite infectious disease guy. He actually gave him IV antibiotics. He hasn't had his rash come back. Thank God, because if you let Lyme go, the theory is that Lyme spirochetes can go everywhere and hide in organs. I'm not going to go down that road. I think I did a video. I'll put a link down below. The easier things to take care of, especially if you're talking about West Nile virus or just standard mosquito bites, you'll be scratching the heck out of the mosquito bite, the insect, the spider bite, or just rubbing up against plants that you didn't like. Scratching is going to be disruptive of sleep. Number one, don't scratch. And I think that's easy for us to say, yes, I'll avoid scratching, but indirectly or unconsciously, you'll see somebody go like this all the time. When you get bitten by an insect, the body will respond. When you brush a tree or a weed, the body will respond by turning on histamine. Just like now, my nose is stuffy because there must be a birch tree blossom. So when the body responds, histamine is on, increased in the bloodstream, and the receptors are really sensitive. The mast cells are ready to fight, and white blood cells are hunting for a fight. All you have to do is go like this once. Even if it's not the area you're bitten, if it's say dandruff or if it's a nervous scratch, your body, the immune system is going to go everywhere and start to respond again. Eyes will be itchy, nose will be stuffy, the rashes everywhere, even in areas you were not bitten, will start to pop up. Swelling will occur. If you're really sensitive and you're an asthmatic, then you'll start to have an asthma attack. Number one, don't scratch. Keep your nails really tight. I'd say at night too, for kids, put socks on their hands. Yes, socks. At least start the night off that way. Number three, have a bag of ice, always handy. I'd put a Ziploc with ice cubes or frozen peas available all the time. When you have an area, say an area that's really itchy, if you slap it, that's just as bad as scratching because you turn on the histamine response. So put a bag of ice, you decrease the irritation, you decrease the blood flow, you dull the impulse to the nerve and you stop the itch cycle. You can put a bag of ice here, 5 to 10 minutes, just don't get frostbite. I've seen that happen too. Put a bag of ice here, you just keep on rotating the bag of ice until you dull up the area of itch. Final thing is, after you take the bag of ice off, and you can do that every 5 to 10 minutes, which is a pain in the butt, but at least it stops the itch cycle, especially before you go to sleep. I love peppermint oil. This is now Foods products from Fruitful Yield. Peppermint oil evaporates and it smells like peppermint. But the idea would be that when you have an evaporative sensation, the free nerve endings on the skin, or the area, say if I have an itch here, if it's evaporative and the skin says, hey, this is cool, because it really senses cooling because it evaporates. It doesn't sense itch anymore and you fool your brain. So that's another option, especially at night or especially with kids that can't stop scratching. One caveat with kids, parents who apply, peppermint does burn the mucous membranes just like this stuff does, repel, so wash your hands afterward. The other thing is you really should check. Whoever is the team leader, parent, check your pets, especially underarms, ears, groins. Check your kids too and spouses. You might not think about it. I found a tick on my back 2 weeks after just filming something in one of the forest preserves near me, and I was only in a patch of grass for probably 30 seconds. And I picked up a tick, found it 2 weeks later, and there's my Lyme disease. So always check and or insist that you check from head to toe. You might have to open up a couple places just to check and make sure. Yes, ticks do get there. I had to pull a tick off a kid's scrotum once. I don't know how he found it. Maybe it was itchy. That was painful. Because in many cases, if you look at the size of this guy, this is not a nymph, but nymphs can be as small as freckles. This is a tiny tick. And if I didn't feel it up here because my scalp is sensitive, I probably would have missed it. Be careful. I don't want to make you paranoid. We should be able to get outside. I've had a lot of people get outside, get to nature therapy and turn off their anxiousness or their panic, and it does work. You can change the dynamic of sympathetic, parasympathetic just with getting out to nature. You can get it exercising. There's many benefits to it, but just make sure you stay safe. If you have any questions, put them in the comment section down below. Please consider subscribing or sending this to other people that are hikers, and I'll see you at the next video. it.